Welcome back. I'm not sure if you all know this, but I chair the planning committee that organizes this summit. And I just wanted to tell you that one of our intentions for the conference this year was to provide you with the data surrounding morbidity and mortality. But we wanted to do more than that. We wanted to highlight local programs who are addressing the issues that have been highlighted by the data, and programs that have done that in innovative ways that are respectful of the families they serve and their unique stories. We are happy to showcase some of the best in our programs this afternoon. I will introduce each panel member, and they will have about 15 minutes to present their services. Then at the end, we'll have a 20-minute set aside for questions starting at 3:30. So please enter your questions in the chat box. I'd like to be able to ask the speakers those questions so that everyone can hear the answers. And I have to start out by apologizing for a mistake on the slide. Fatima is with moms, dads, and babies. So Fatima Muhammad Roque is our first presenter. She is a Phoenix-based doula with more than 20 years of experience, and she is a certified professional midwife. She has led in-person training programs for women from diverse backgrounds from across the Phoenix area who aspire to become doulas. Her program had a specific audience in mind: women who want to support other women, especially women of color, especially women who have a need for support, for healing, for optimal outcomes. Welcome, Fatima.
Good afternoon, everyone. It is a pleasure to be here. I am going to start off with letting you know that I am really excited about this presentation. So See Me Differently: How Mental Health and Substance Use Impact Maternal and Infant Mortality. So as Jeanette said so beautifully, we are sharing innovations in community-based social and cultural support for families. And today I'd like to introduce you to MODABE, which stands for Moms, Dads, and Babies, and how we approach maternal, paternal, and child health for families, and how we also utilize that lens, specifically focusing on African-American families. Our lens will, everybody just came home from school. And then the dog started barking. I apologize. So we are working to reduce high infant mortality rates in the African-American community, also to make sure that we're also looking at BIPOC families, as well as I just had to let my family know I was doing a presentation. Our mission is on the screen, how we like to center our approach, and is to reclaim our practice, our ancestral traditional wisdoms, while elevating consciousness before, during, and after pregnancy by creating sacred space, offering nurturing quality care, information, education, support, and training our families and community for healing, informed decision-making, optimal outcomes, empowerment, culturally reflective and trusted care, and ultimately so that we thrive. With that being said, I'd like to acknowledge 2 births. So I'm coming off of birth time. I'm still in adrenaline. I just had a birth this morning. So we welcome baby Amina to the world today in the home birth setting. And also on the 22nd, we welcome baby Safa. Next slide, please. So what does it take to see me differently? To hear my voice, to have a seat at the table, to have the resources I need and deserve, to have quality, affordable healthcare, to have bodily autonomy, to have healthy food and housing justice, to be able to nurse my baby in public freely, to restore the land, build a home, and receive reparations long overdue. Some would say, walking a mile in my shoes, others, a global pandemic. Me, it doesn't matter what it takes. What matters is that I'm seen and that you know I will no longer settle for less. So this was a little reflection that I wrote going through this slide deck and preparing for the presentation. We hear so many families' voices. Like I said, we center African-American families. And these are some of the things and themes that come up in our work. We center, like I said, BIPOC, Black, Indigenous, and people of color, as well as underserved. Next slide, please. So blessings, my name is Fatima Muhammad Roque. My pronouns are she and her. I am a wife, I am a mother, I am a village mother, an auntie, a birth worker, a daughter, a lover of family and community, and so much more. So I'm asking, who are you and how do you like to be seen? So I'd like this to be an interactive presentation. If you could please share an emoji that represents who you are. Unfortunately, as a presenter, I can't see your emojis, but I would still love to reflect on them afterwards. Next slide, please. So what do the statistics or they say about African-American maternal and child health, about Black fathers, Black birthing, Black breastfeeding, and Black parenting? Please share your comments. And oh yes, I can see them. Oh, this is great. I see sunflowers and praying hands and smiles and faces. I see Yvonne with hearts. This is excellent. I love it. I love interactive Zoom presentations. So my next question is, what do the stats say about our community? What do people say about our community? I saw a beautiful butterfly. Please add some comments in the chat. And as you start to pull those comments in, please share, how can or does this impact mental health? And what are some of the systemic whys of some of the statistics and what people say? Also, how has historic trauma also played a role? So some people are invisible, says Cecilia. Come on, bring those comments into the chat. What are the statistics saying about our community? We all want to be seen. What else are the statistics saying? Lack of representation, African-American moms die at higher rates, great job. Inequality, work to do, resilient, higher mortality rate during childbirth, lack of access, excellent, poor access to care, all of these things. And since we're centering seeing me differently, health of mom and baby, I want to make sure that we are clearly seeing families, and especially because my community is near and dear to my heart, especially listening to our voices. There's a saying that says, listen to Black women, listen to our community, listen to BIPOC families, listen to the underserved, because those who are closest to the problem are closest to the solution. And it doesn't matter what socioeconomic status it is. Beautiful. Next slide, please. So we like to come from an asset-based perspective. We, meaning Modabin, our organization, Moms, Dads, and Babies. And we're positively changing the narrative. So we have some visuals here of families. And because we're working on seeing our community differently, what do these images say? Let's see, top here, where we have this mama with the light shining on her. What does this image tell you when you look at it? That yes, we do what? And this family here, as well as here, as well as here. Yes, we do support, we love, we breastfeed, we empower, we care. Absolutely. Right here. What about this? Pride in family, reconnecting to our roots. Excellent. What about here? I'm pointing to the bottom left of the screen. We have joy. Fathers are just as important. Excellent. And togetherness. Yes. Absolutely, everyone. Big round of applause. Yes, all of those things that we breastfeed our babies, even though our statistics say that we don't, that we have home births, even though our statistics say that we don't, that our fathers are present, and that our fathers are very loving, very kind, very gentle, very protective of our families, and often don't have a voice. We love our children, and we like to enjoy our children, and we sow into our children, that we like to eat healthy food, even though the statistics say that, we're obese and that our diets are not the most ideal. So we really want to reframe and change the narrative. And I want you to think about, if you constantly hear statistics about your community that speak to high infant mortality rates, moms are dying at 3 times higher than white women, moms are bleeding, moms aren't being listened to, moms have higher pain tolerance. What does that do to mental health? Anybody in the chat? What does that do to mental health? We have 380 participants. It can cause depression and anxiety. You can start to believe it. Exactly. So hearing these things, it can also take a toll on our pregnancies. It can also take a toll on our families, our partners. It can bring fear into the birthing experience, especially when there's a history of trauma in our communities, of feeling overwhelmed, pressure to be strong, self-doubt. What about the voice? What about our voice? Isolation, hopelessness, all of the above, all of the above. So at Modabe, we partner with several community-based organizations so that we are working on a lot of different perspectives to make sure that our families are loved on and heard and seen clearly. Next slide, please. So these are some of the things that we're doing to make sure that we are refocusing, recentering, empowering our families, promoting positive self-image and personal and family empowerment. We are promoting self-care. There's this stigma that Black women are so strong, and we are, but sometimes it's strong to a fault where we feel isolated, that we can't reach out to other members of our community, or we have to hold everything. We work hard on reclaiming health and traditional healing and birthing practices, acquiring land and land ownership, also having a village where we can say, I feel safe here to talk about issues that are happening with my family in my community. We collaborate. So one of our collaborators, one of our partners is the Siwa Potley Collective, amazing partnership, Mass Liberation, Arizona. We've partnered with Sonoran Prevention Works on some of the substance use program. We have several collaborators in our community. Tanner Community Development Corporation, Freedom in the Seed, where we offer home birth midwifery care, training, culturally reflective workforce. So in these images in the upper, I'll say right-hand corner, we participated in a Spinning Babies class. The image in the bottom is one of our doula cohorts, and these ladies are called Village Mothers. And then in our upper left-hand corner, this is one of our families who engaged in home birth midwifery care in our partnership with Freedom in the Seed. And so we've also just finished, a lot of our community finished the Black course and became Blacktivists, so focusing on Black breastfeeding approaches and trauma-informed care. What else? Utilizing our assets and promoting mutual aid. So we're showing up for one another, growing capital and building relationships for sustainability, reinvesting in our community, loving and nurturing relationships, supporting and growing the village, sharing wealth, as well as working on policy. So we're also working with Institute for Medicaid Innovations on creating ideas and looking at BIPOC midwives and families to see if access could be utilized. Let me rephrase that. How access could be better utilized by families. Where are some of those gaps? And also, if families wanted to engage in home birth midwifery, how can we create some of those better practices and impacts in policy to have a broader range of resources. Next slide, please. So here, I want to pause actually and see if there are any questions or any thoughts, because I love interactive and I am so community-based that it's really important that I hear from the community that's in the audience and see if there's any information so far that you'd like me to expand on. Beautiful work, says Jenny. I appreciate it. So one thing I do want to talk a little bit about is we're really working hard to establish a wellness center in South Phoenix. And so in establishing that, it's a group of community-based organizations that are coming together to work on this project. It'll be in several phases. And so we're really proud of the work that we've done thus far. And we're also inviting community to come along and work on building strong and sustainable community to benefit birth, families, and our collective family, our collective community as well. Focusing, like I said, on African-American families for us because of our health disparities, but welcoming the greater village as well. So what can you do? You can donate. You can support our capital campaign. You can share grant information. You can share the wealth in general. You can offer in-kind expertise. You can share a contact that may have some resources or expertise that could be beneficial. You can promote positive self-imagery and narratives of Black families. You can think and act equitably. You can volunteer, or you can simply self-identify. You know, how do you want to show up? Or is there a way that you would like to show up? And next slide, please. So I know my presentation was pretty short, but I want to say thank you for your time and attendance today. My information is at the bottom. If you have any questions or you want to learn more, if you want to partner and see if we align, that would be amazing. I love community. I love being with families. I love my African-American community, BIPOC community. I love my community at large. And we're really working to center, you know, reclaiming our narrative, especially in our African-American community. Have a beautiful day. Like again, I'm celebrating our babies that were born, so I'm still on birth high and also a little bit sleepy at the same time.
Thank you, Fatima. And that baby in your PowerPoint is the cutest darn baby I think I've seen for a while.
That's our baby Soul, Jalen's Soul.
Oh, very cute. Well, thank you so much. And you were right on time. So we're moving on to our next presenter. Jeanne Nizigiyimana is the program manager and co-founder of Refugee Women's Health Clinic and chair of the Community Advisory Council. Filling in for her today is Julia Lorence, MPH graduate student at Baylor University, interning with Valleywise Health Refugee Women's Clinic. Valleywise Health fully supports refugee communities, their resettlement, and is committed to offering them the care they deserve, the way they deserve it. One of the ways they do this is by employing members of the refugee community as cultural health navigators to serve as liaisons between the healthcare system and patients. Welcome. Thank you for coming, Julia.
Good afternoon, everyone. Thank you for the kind introduction. I humbly request your attention on behalf of my supervisor, Jeanne Nizigiyimana, the co-founder of the Refugee Women's Health Clinic at Valleywise, who sadly could not be here today due to an unexpected loss in her family. And I'm humbled to present on her behalf. Next slide, please. So these are our objectives that we will talk about today. Next slide. Per the United Nations 1951 convention, a refugee is defined as someone who has fled their home country and is unable to return due to the fear of persecution based on the person's race, their religion, their nationality, or a membership of a social group or political opinion. As of April 2022, there are 26.2 million refugees worldwide, and the majority of them are women and children. Next slide, please. Arizona has long been a home to refugees, with over 80,000 refugees having been resettled to our state. And as you can see on the slide, over the last 5 years, these are the top 5 countries of resettled refugees that we've welcomed here. Due to the ongoing conflict in Afghanistan and in the Ukraine, we've also seen over 2,200 Afghan refugees coming to Arizona in the fiscal year of 2022. And due to the ongoing war in the Ukraine, we've also seen slightly over 70 Ukrainian arrivals that came here through the United for Ukraine program. Next slide. To address the unique and distinct needs of refugee women here in Arizona, Value-Wise Health has launched the Refugee Women's Health Clinic in 2008 to offer culturally grounded and linguistically appropriate health services. Our vision is to reduce and eventually eliminate health disparities and cultural barriers to care. And our top 10 refugee countries served at the Refugee Women's Health Clinic are reflected on the next slide. So as you can see, over the last 11 years, we had several patients from different countries, including the Democratic Republic of Congo, Somalia, Iraq, Burma, Burundi, Sudan, Rwanda, Syria, Afghanistan, and Ethiopia. And as a result of the great work of Jeanne and Dr. Johnson and the Cultural Health Navigators, Value-Wise Health has expanded their refugee service lines. Next slide, please. So the new comprehensive refugee service lines include the pediatric clinic, as well as primary care services, and also family medicine, which can be found at the different locations in the Valley. And the locations depicted here on the slides are the locations that are most frequently sought out by our refugee patients. And here you can see our beautiful team and our cultural health navigators. Next slide, please. Our team is comprised of cultural health navigators, as Jeanette already mentioned in the beginning, a model that was launched to help refugees navigate the complex US healthcare system. Our CHNs are members who share cultural beliefs and values with their patients, and they understand and respect specific cultural, but also unique healthcare needs that these patients bring with them. And additionally, they're trained bicultural, sometimes multilingual interpreters, and act as role models, but also as healthcare brokers. Part of their clinical duties includes care coordination to ensure that we address barriers in accessing care, which includes the coordination of transportation, for example. They establish a plan of care to obtain services based on outcomes goals. They facilitate referrals to refugee-specific benefits and services, but they also support our patients by either obtaining or maintaining their healthcare coverage, which is incredibly important to have good health outcomes. And most importantly, they're incredible at facilitating health literacy and education workshops to empower our patients here at Value-Wise Health. Next slide, please. Being a woman in the war makes female refugees very vulnerable due to the following reason of gender-based violence, but traumatic displacements and gender inequality, and thus women are at higher risk of psychological distress. In the state of Arizona, we see the 7th largest Somalia-born population in the US, and based on indirect estimates by the Population Reference Bureau, there are nearly 7,500 women and girls that are at risk for female genital mutilation and cutting. In the state of Arizona, healthcare providers may encounter these patients more likely, with the FGMC related morbidity among this population. And thus these women who experience this practice may present with physical and mental health implications that need to be addressed. Considering these issues that women face, Valley Wise Health Refugee Women's Health Clinic immediately recognized the need to incorporate behavioral health services into routine care so that holistic services could be provided to our patient population. Next slide, please. So our team here at Valley Wise Health, they utilize validated tools such as the Refugee Health Screener, also known as the RHS-15. And then our cultural health navigators refer our patients to refugee-friendly behavioral health providers. And that has been instrumental. As you can see here from our current data over the last few years, there's an increase in positive screeners. So we want to make sure that we refer our patients that are in need of behavioral health services to the right providers that can provide culturally competent behavioral health care. And the next few slides are examples of best practices addressing maternal health. So in 2016, our cultural health navigators created videos in different languages as part of the Replay initiative to educate refugee women on reproductive planning and birth spacing. And among the great finding of this study was that women experience greater comprehension of what it means to have a reproductive plan, and also understanding the benefit of waiting 2 years before having another child. Another example of a wonderful initiative here at Valley Wise Health Refugee Women's Health Clinic is the Expectant Mothers class. And the Expectant Mothers class teaches mothers who are in their 3rd trimester pre and postnatal education. And overall, we have taught over 550 expectant mothers that were able to not only increase their knowledge and their self-efficacy, but most importantly, they were able to establish and keep their birth plans, which is very empowering to them. Our last example of best practices includes an initiative that focused on enhancing culturally informed healthcare services of women that were affected by female genital mutilation and cutting. And Dr. Johnson Agbaku led an expert team to train local providers on the protocol for caring for women who experienced this practice. First, a community health needs assessment was established to understand the level of knowledge, but also the available resources. And then second, outreach was provided and education was catered by age and gender group to disseminate the information they needed for quality care. And lastly, they developed a training for providers to build their confidence on how to care for these patients. Next slide, please. So when we talk about how valuable our healthcare, our cultural health navigators are, there's a great value in utilizing cultural health navigators to help improve quality outcomes for mothers and infants. And some of our performance measures include the timeliness of prenatal care and postpartum visits, also inpatient admits, and a live birth less than 2,500 grams. For this pilot project, the baseline period took place between July 2017 to 2018, and then we had a performance period from July 2018 to June 2019, and you can see the results on the next slide. So if you look at the column that has the percent change, you can see indeed there's a cost saving when we employ cultural health navigators, and the outcomes are obviously positive. With a reduction in inpatient admission that we saw, we had a reduction of babies that weighed less than 2,500 grams, and we had an increased number of women accessing prenatal care timely to ensure that mom and babies are well and healthy. Other clinical outcomes that address social determinants of health are the access to care. So over 9,000 refugee women from 71 different countries speaking over 68 different languages have made Valley Wise Health Refugee Women's Health Clinic their care home. The health education videos created by our cultural health navigators and disseminated by them in their native language helped tremendously, especially during the COVID pandemic, and have led to an increase of COVID vaccination uptake among our refugee population. Our behavioral health screenings led to a successful referral rate of over 88% of positively screened patients to connect them to the mental health services that they needed. And an average of 500 patients attend the value-based health resource fairs, where they are offered more resources on the spot, including social services, for example. Next slide, please. So based on this slide, Jeanne would strongly advise that for patients to be empowered by the care team is when you apply these principles, if one desires informed and quality outcome comes. And that's why here at Valley Wise Health, they try to match a language and a culture whenever it's possible and promote a joint plan for informed decision-making. And most importantly, hear and listen to our community members, because we don't want to create programs that, that we want to implement, but we want to hear from our patients, because they will tell us the programs that they need to thrive. Next slide, please. And like it takes a village to raise a child, it takes a community to help remove the barriers to access to care and to address cultural competence services. And so hopefully we can continue to collaborate, across all service lines to ensure that we empower those that are the most vulnerable members of our community. And the next slide are the references. And I would like to extend a sincere thank you to the cultural health navigators. I think some of here on joining us today, our providers, our refugee women's healthcare team, and our most sincere gratitude also to our internal and external support for making this initiative possible. Thank you so much.
Thank you, Julia. That was wonderful. We had so many comments coming in about what a great job you guys do. For this next presentation, I want to tell you about a group of women who came together in 2015 after experiencing a lack of community support for families and womb health. Since then, they have led the effort in Phoenix to bring Indigenous families together to share knowledge, wisdom, and provide care for those in need. It is my honor to introduce Ivette Fullerton, the Director of Grants and Contracts for the Siyupakli Collective.
Good afternoon, everyone. It is an honor to be in this virtual space and community with you all, and an honor to share the stage with such amazing organizations doing some really important work. I want to acknowledge and honor my presence on the beautiful territory of Kumeyaay lands, presently known as San Diego, California, where I'm currently broadcasting from. My name is Ivette Fullerton. My pronouns are she, her, ella. I'm a Chicana, firstborn daughter of immigrant parents from Mexico. I'm a co-founder and the director of grants for the Siyupakli Collective. I'm also a certified perinatal mental health provider, providing coaching services to birthing and new parents. I advocate for maternal health through policy efforts by consulting on the Arizona Department of Health Services Maternal Mental Health Task Force and Maternal Mortality Review Committee. And I'm here to share with you all the work of the Siyupakli Collective. Siyupakli means women's medicine in Nahua language, originating from the peoples native to southern Mexico and Central America. Siwa means women, Pakli meaning medicine. And for us, this is in the form of food, herbs, community, and ceremony, all connections which we want to reclaim in our healing process. Next slide, please. The Siyupakli Collective was founded in October of 2015, so we're shy of 7 years, by a mother, Maria Parracano, struggling with postpartum depression, who called out to her community for support after the loss of her mother and the birth of her second child. A few mothers, grandmothers, and tias began to meet regularly at a local community coffee shop, with a number growing every week. Eventually, resulting in our 14 founders. Since 2016, the Siopakli Collective has been known to provide a safe space for self-identifying women in the community to navigate the various challenges and cultivate the strengths associated with urban Indigenous motherhood. Today, the collective has a scope of services beyond maternal and postpartum support. Our purpose is to provide healing for self-identifying urban Indigenous peoples from the diaspora. We achieve this through 4 areas, which we refer to as bundles. The first one being cultural revitalization and education. The second, food justice and land restoration. The third one, birth equity and reproductive justice. And the fourth one, advocacy and consultation. Next slide, please. The goal for our cultural and revitalization and education bundle is to foster spaces where ancestral knowledge and traditional knowledge are shared by Indigenous peoples across the diaspora. We believe that changes in the home ripple out to our community. Our vision is collaboratively nurtured by Indigenous families who share knowledge with their community, influenced by the understanding that the legacies of colonialism continuously impact the collective's dignity. This understanding is reflected by being inclusive to all self-identified Indigenous women and their families without judgment. And we do this by sharing stories, revitalizing traditional knowledge, connecting resources, and promoting health and wellness. We are rooted in ancestral and traditional knowledge, and we are committed to highlighting ancestral strengths through culturally restorative education. The women of the collective have devoted themselves to understanding and utilizing traditional Indigenous practices throughout the lifespan, with a special focus on maternal health and infant care. We are committed to addressing the health disparities that plague marginalized communities as a result of systemic oppression in a holistic and culturally affirming manner. The services and projects encompass both healthcare and education by addressing healthcare concerns and disparities within a traditional knowledge lens. And we use the comadre, which is also known as the co-mother model, that is based at the foundation of the community health worker framework to reach marginalized communities in innovative ways. By sharing knowledge, we can impact communities by empowering them to practice these methods at home or to seek out more appropriate culturally responsive support. Next slide, please. So this is a little bit of what we have done here from now since we began. And we like to ensure that traditional knowledge and spirituality, culture, and community are always at the core of every workshop, community event, and or gathering. Our work is unique to Indigenous families in comparison to the work of other organizations in the region because our reach is more expansive in scope, but also specific to the urban Indigenous community throughout the state. Since 2020, we have served over 15,250 women and their families through our food sovereignty and birth justice work as a direct response to the COVID-19 pandemic that has gravely affected our BIPOC communities here in the state. Some examples of our offerings or services include our traditional knowledge workshop series, annual ancestral wellness gatherings, traditional ceremonies pertaining to postpartum support, birth blessings, coming of age, and danza. As urban Indigenous peoples, the collective acknowledges migration as a human right and supports families traveling to and through the city of Phoenix from reservations, Indigenous nations, and sovereign communities throughout North America, the Caribbean, to Panama, and South America. Our footprint has expanded throughout the state, with Indigenous peoples represented from a minimum of community. Next slide, please. Our goal through our food justice and land restoration is to acquire and own land for the building of a community wellness center and a farm where we can center and teach traditional knowledge, native science, and ceremony in ways that connect birth equity, reproductive justice to food justice. We really do believe that it's a holistic approach. Food is at the center of many of the initiatives and activities within the collective. Nutrition is central to all phases of caring for families during the stages of pregnancy and postpartum. Our healing garden houses some of the herbs essential to the full spectrum needs during this time. Many of the herbs support the mental, emotional, and spiritual needs of the birthing person, making the connection between regenerative aspects of food and wellness. Treating both the family and the birthing person as a whole requires the creation of new systems and institutions that prioritize sovereignty. A medical system that treats the entire person must be supported by sound nutrition. When the nutrient source is embedded in one's culture and traditional knowledge, the community also achieves food sovereignty. We believe that food sovereignty is the right of people to have access to healthy and culturally appropriate food produced through ecologically sound and sustainable methods, and their right to define their food and agricultural systems. Next slide, please. We have distributed about 1,600 Indigenous care packs since November of 2021. These packages are composed of local dry goods that are nutrient dense from local Indigenous farmers and producers in the state. We're currently in conversations with the City of Phoenix for the acquisition of land to establish a community wellness center and food forest with some of our partners like Modaba and MassLib, and where we can grow food and support local birth workers in the community in South Phoenix. Next slide, please. The goal for our birth equity and reproductive justice bundle is to increase culturally responsive care for BIPOC families during all reproductive stages. The collective has served many women who have experienced maternal morbidity or culturally insensitive healthcare providers, which have sometimes led to negative and/or traumatic outcomes. Speaking from personal experience, I am a survivor of maternal morbidity. I have struggled with severe postpartum PTSD after the birth of my first child. Through my education and training and privilege, I was able to receive EMDR therapy, but I still felt misunderstood and almost as if something was just not clicking. Unfortunately, receiving mental health services, especially with a focus on maternal mental health, is not seen as a necessity. And so I do say that it is a privilege, even though it's a necessity. 2.5 years later, I found myself pregnant again, but at this time I had already established relationships with the women from the collective and began to learn about my cultural practices pertaining to pregnancy, birthing, and postpartum. I was lucky enough to implement many of them, and even though I really had hoped for a redemption birth, unfortunately, it just was not in the cards for me. I experienced another traumatic birth and close call, but at this time, what I like to say that I've been on both spectrums of going through two traumatic experiences, not having community, and with one, not being connected to my culture, and struggling for over 2 years. And then my second time around, I did not experience postpartum mood disturbances. I was triggered. I definitely had situations that came up, but it was not as long, and I had an amazing support that made all the difference. And I had my cultural teachings and my spirituality that really got me through. So as I came to find out personally and professionally that a significant protective factor against trauma, especially racial trauma, is cultural identity, a positive sense of oneself as existing within and belonging to a cultural group, especially one that has been historically marginalized. There is a lot of erasure and history that is not told, yet the trauma continues to impact our families. There have been generations of hiding their identities for survival and assimilation. Our culture is our strength, our people are our strength. Traditional knowledge helps us look at things as a whole, which is crucial for birthing people because we carry the seeds of our grandchildren. Therefore, culture, community, spirituality, and wellness are intertwined with the health and survival of birthing people and their infants. Next slide, please. We pride ourselves in responding to the needs of our community. So as a response to the Phoenix Indian Medical Center labor and delivery unit closure that shut down in August of 2020, displacing birthing mothers, we created the Collective Birth Fund. These funds have been used for advocacy support towards payment of medical bills associated with birthing options for at-home or non-hospital births, support from an Indigenous birth worker that may not normally be included in their birth plan, and referrals to other community partners, as well as postpartum goods such as diapers, wipes, formula, hygiene items, feminine products, and food items as well, fresh food, dried goods. We also use this fund to provide scholarships for continuing education and licensure for community birth workers of color. Next slide, please. Our goal for our advocacy and consultation bundle is to support local, national, and international BIPOC movements and causes related to birth equity, reproductive justice, food sovereignty, and land restoration. We stand in solidarity with other organizations that specialize in providing support and services to marginalized communities. We actively participate to dismantle and change oppressive systems on all levels, from policy, advocacy, to engaging communities and meaningful traditions. Next slide, please. And here are some of the ways we have worked towards achieving our goal, but most recently, we have developed a community urban Black and Indigenous focused doula curriculum with our pilot to begin next month, which we are very excited about. Next slide, please. And here are some of the women that are at the core of the community, at the core of the work being done within the community. Next slide, please. And that is all. That's Tlazo Kamati. Gracias. Thank you. I wish that you all have a beautiful rest of your day, and just thank you so much for allowing me to share some of the work that we've been doing the last couple of 7 years. Thank you.
Thank you, Ivette. And I just have to say, we're getting lots of those comments in about how amazing you are in your group, and I have to wholeheartedly agree. Our next panel member is Dr. Jennie Bever. She is the CEO of the nonprofit Fourth Trimester Arizona, which was founded to support the mental, physical, and emotional health of parents in the first 5 years after a baby is born. Jennie holds a doctorate in biology from the University of California, San Diego, and a bachelor's degree in biochemistry from Arizona State University. She founded Fourth Trimester Arizona with a mission to change the culture of parenting so no one has to do it alone, and the vision that all families are embraced by their communities in their transition to parenthood. Welcome, Jennie.
Thank you so much for that. I have to say, I am really, really honored to be among this illustrious group. Speaking today. Ivette, your comment about carrying the seeds of our grandmothers, yeah, that touched me. So thank you for that beautiful, beautiful work. Thank you for allowing me to be part of this. As I said, this is definitely the right place for me, and I'm just honored to be at this summit today. So I wanted to take a moment to talk about what the fourth trimester is. I think I get a lot of questions about the name, because people say, well, trimester, right? That's 3. So what in the heck is the fourth trimester? So I'm lucky to have a friend who takes beautiful photos while pregnant. I am not one of those people. And these are all of her, showing her in the first, the second, and the third trimester. And on the right is a picture of her in the fourth trimester. And so the fourth trimester is considered the first 12 weeks after a baby is born, when a human baby is neurologically and physically immature in comparison to other mammals. Unlike most other mammals, human babies need 24/7 constant feeding, holding, comforting, and care during this time. For mothers, that first 12 weeks is also a dramatic time of change, where almost everything around the mother changes, from their physical, mental, and emotional health to their relationships, workload, and sense of self. while it's technically the first 12 weeks after birth, for many mothers and infants, the 4th trimester continues through the 1st year of life and beyond. During this time, our medical system spends a lot of time making sure that baby is okay, and that makes sense, setting up 9 scheduled visits in the 1st year of life. Yet for the mother, the 4th trimester is often the trimester in which, to the healthcare system, she disappears. Most new mothers have only 1 scheduled postpartum visit, leaving them largely alone and unmonitored health-wise unless they have the time and energy to reach out. In most other cultures, traditions set mothers apart during this time, with defined postpartum rest time and often celebrations to honor and protect the new mother when she is at her most vulnerable. Most mothers in other developed nations also get paid maternity leave. US mothers are lucky to get any maternity leave at all, and 1 in 4 US mothers goes back to work within 2 weeks of giving birth. And unless you think that that's not anyone you know, I will tell you that working at a university, I talked to several mothers who went back the day after or 2 weeks after their babies were born. So it definitely happens here in Arizona. We know that prior to the pandemic, 1 in 5 new mothers experienced postpartum mood and anxiety disorders. And this got even worse during the COVID-19 pandemic. Honestly, I don't think we have very much current data as of 2022, but this was 2020. And you can see that the rates of postpartum depression went up significantly, and the rates of postpartum anxiety, which are often higher, went up even more. The United States also has the highest rate of maternal death in the developed world, with more than 52% of the deaths actually happening after the baby is born. And this is significant because this is a time when the healthcare system, as I said, is often not monitoring the mother. And so without those health systems, without those traditions, this is a very, very vulnerable time for mothers in the United States and here in Arizona. It was for these reasons that 4th Trimester Arizona was founded, and Jeanette was so nice to read our mission and our vision, but really bringing home the idea that we shouldn't have to do this alone. And this is a lot of why we're having so much trouble, right? We feel like this should be easier, and it looks easier in the media. And we feel like, what is wrong with us that it isn't easy and fun? Well, it's that we don't have the support that we need during this time. 4th Trimester Arizona connects maternal and child healthcare providers with social support systems and parent support groups to foster collaboration, education, and to increase access to local resources. Our programming includes 3 main focus areas that I'm going to talk about today. So our 4th Trimester Village Gatherings, our 4th Trimester Arizona Conference, and our 4th Trimester Ecosystem. So starting in 2017, we started having what we called 4th Trimester Villages, and they were initially in person at the Idea Museum. And in 2020, like everyone else, we moved online. And in that time, we grew from 1 4th Trimester Village to 6, soon to be 7. And so now we are offering villages 6 times a month. And we have 1 village that is now meeting in person, and the rest are all online. And the nice thing I've found about them being online is they're accessible to anyone, anywhere. And we've had people join us from the UK and Canada, which sort of surprised me. They provide access to postpartum education and to a community of parents and providers from the community the village serves. So we're also very specific about that, so that the families can actually reach out to those providers if they need that type of support. They're also really safe spaces to ask questions and receive support from other parents. If you're interested in being part of a village, you can go on our website and find the one that suits you most. As I said, most of them are still online. Our central village is slowly hybrid moving to being in person at the Idea Museum. We focus on providers from the different regions that you see here. However, you're welcome to join any of them. And I'll talk a little bit about the Black Mama Support Village that is specific to that community, and also the Cuarto Trimestre in Espanol. So what you might find at our villages, depending on which village, they each have a little bit of a different flavor. Our East Valley Village is very much focused on postpartum hacks. And I'll tell you that the hack from last week, boundary setting, was led by Michelle Lacey, and it was amazing. I need to hear that about 5 more times. But some of the other things that you'll hear are things like pelvic healing. So for this one, this was the Tucson Village. They had a pelvic floor therapist from Tucson come and talk about what that might look like after you have a baby and how it might impact you into perimenopause as well. The two on the bottom are both from our Central Village, where we talked about relationships, which was a great one. We might think about the relationship with our partner changing, but also our relationships with our parents and with our friends, and often our coworkers really change after we have babies. And the one on the right, sleep. So sleep is something we all need more of, and especially when you have a baby. And that session in particular was really helpful as we talked about how to still support your baby while supporting your own mental health through sleep. So I mentioned the Black Mama Support Village. This village would not be at all where it is, and definitely would not have been created without the suggestion of Lakeisha Muhammad from Arizona Birth Workers of Color, who brought the idea to me. And so I am just amazed and astonished by how wonderful this village is. It is led by and for them, and they have turned it into what it is. It meets on the third Wednesday of every month and is specific just for Black mothers. So if you are a Black mother, or if you know a Black mother who could use some support in community, this is a great space for them. And as I said, I completely attribute this to the Birth Workers of Color, who have done such an amazing job with this village. I couldn't have asked for better collaborators. They're just totally amazing. Our Cuarto Trimestre en Español is actually funded by Postpartum Support International. They gave us a small community grant to establish this village. And this is led by Nellie Willis, who is a wonderful peer support specialist who really has a passion for bringing fourth trimester education and community to families that are Spanish speaking. And so we are slowly but surely adding more and more resources in Spanish to our YouTube. And if you'd like to follow us, you can actually find our Cuarto Trimestre en Español has a separate Facebook page, and we post lots of videos there. Our villages are also live streamed there. So if you're interested in that, please join us. We are always interested in new speakers too. So if that's something that you might want to present your resources, I think Nellie would be very excited to talk with you. Our fourth trimester conference is another one of our programs that is really key. This is one of the first things we dreamed up when we were starting the fourth trimester. And it's really a day where we take over the Idea Museum, at least that's what we've done so far until COVID, and fill it full of love and parents and education and support. So we have 3 sessions running throughout the day, all about the postpartum. So mental, physical, and emotional health, as well as self-care. And a wonderful exhibitor fair that I think makes the whole thing. And this is really our effort to come together as a community to support those families and create that village and make everyone aware that it's there, because that's the other piece, right? You have to know who's there if you're going to be able to access that village. This is the image from our conference in 2022 that was in April. It was online. One of the big advantages of being online is that it's super easy to record everything. So if I have to have a silver lining, there it is. And so if you want to see any of our 2021 or 2022 sessions from our conferences to just kind of see what kind of things we do, you can actually go online. You go to the For Parents, and there is a link that says postpartum modules, and it has our 2021 and our 2022 conferences there, as well as a lot of sessions from our 2020 conference. I feel like this is one of the things you can give parents in the middle of the night. That one in the middle is actually about sleep, practical strategies. So if they're worrying or wondering about pelvic floor health or postpartum depression or anything else, there are lots of resources there, and they're all local. So our most recent effort, as far as families go, is our fourth trimester ecosystem. And this really grew out of a dream that recognized that new families are actually surrounded by a lot of people, a lot of people. But in reality, we're not all talking. We don't all have the same vision or knowledge of what families need. And so as a result, they get a little bit here and a little bit there, but maybe not the real system that they actually need. So if you look on the left, you see this image of a mother and a baby surrounded by all these different groups. So in a fourth trimester ecosystem, you might expect an OBGYN, you might expect a pediatrician, you might expect a home visitor, right? And maybe even a lactation consultant. But have we thought yet about the fact that there are so many other groups and so many other people that influence and can impact these families? Facebook groups, grandparents, aunties and uncles, friends, speech therapists, childcare, NICU nurses, public health, faith communities. To me, I'm telling you, the Target and Walmart cashiers, I need to get them on this ecosystem because they know what's happening in the middle of the night when moms are going there. But bringing all these groups together to begin to talk about what is happening here in Arizona. What are the things we can do here in Arizona? What are the issues that mothers and babies are facing here in Arizona right now? And how do we move forward? So that's really what our fourth trimester ecosystem is about. And the main event of the fourth trimester ecosystem, our inaugural event, happened last year. It was our fourth trimester ecosystem summit. And it was a wonderful event. We had over 250 attendees, and we came together to really talk about the impact of COVID-19 on maternal and child health, like what had happened and what were we seeing on the ground right then. Because I think that was the other issue, right? Like we still don't have all the data that we need to make those types of decisions. And for those of us who are working with families, we really need that data. We really need those conversations with each other. And so it's a wonderful space, and I couldn't have been happier with the outcome. If you would like to take a look at last year's summit, you can actually see it on our website under the For Professionals link. It's all there, and that might give you an idea of what we do. We also do fourth trimester ecosystem lunchtime conversations every other month where we talk about similar topics, but in a little bit shorter format. And we opened our fourth trimester ecosystem summit registration on Friday. So if you're interested in being part of the conversation this year, it is again free of cost, thanks to support from the Department of Health. And we're talking about some of the issues that are currently impacting families or that have impacted them in the past year. So things that just kept coming up over and over were the infant formula shortage and childcare challenges. We're also bringing in PSI Arizona to talk about maternal mental health, and some wonderful speakers to talk about cultural safety and creating a safe space for families in every situation. So I'm really excited about that one. If you check out our website, do I need to move faster?
You're good. You've got a couple minutes left.
Okay, good. I think I have 2 more slides. If you would like to get involved with us, we would love to have you join our ecosystem. For sure, that is a big piece and maybe the quickest, easiest way right now, especially for those of you who support maternal and child health. Engage in events. If you are a mother or someone who has a child, engaging in our fourth trimester villages for sure, as well as our ecosystem summit and our lunchtime conversations. We love guest speakers, especially local ones who can talk about issues that face postpartum families. So if that's something that you do, we would love to have you connect with us to talk about those things with families. And then if you're interested in being an exhibitor or a sponsor at either our ecosystem summit or at our fourth trimester conference that'll happen in April of next year, let us know. That's definitely a great way to be involved as well. Thank you very much. If you want to contact me, you can reach me through the Whova app, or you can reach me at these different emails as well.
Thank you so much, Jenny. That was a great presentation. And I am absolutely stunned at the discipline of the speakers today. You all hit your mark perfectly. So, yeah. Okay, so I got to say this for Jenny as well as all the speakers today, but I kept flashing back on 35 years ago when I had my first baby, and I was in a little remote rural area in Arizona, and I had no support. And I remember just crying and flipping through that book, The Womanly Art of Breastfeeding, trying to figure out what I was doing. And I had nothing. And so it just warms my heart to see all this. So thank you for what you do, everyone. And speaking of breastfeeding, our next presenters are from the Arizona WIC program. Zarina Alstrom is the Arizona WIC breastfeeding coordinator. Zarina is a breastfeeding advocate who started her career as a registered dietitian, working in various settings, including the Arizona State Hospital. She found her home at WIC and achieved her IBCLC credentials in 2018. Amanda Shumway is a breastfeeding advocate that focuses on empowering families. Her career at WIC started in 2013, and she became a credentialed IBCLC in 2017. For the past 4 years, she has managed the breastfeeding peer counseling program for Arizona WIC. Welcome, Zarina and Amanda. So glad you're here today.
Hi, everyone. How are you today? Thank you so much for hanging in there for, I think we're the last presenters today. Can you see my screen okay?
Looks great.
All right. So just Jennie, thank you so much for that great presentation and bringing up breastfeeding and how all of the fourth trimester that just feeds so nicely into what we're going to be talking about today. And again, thank you so much for having us speak at this summit. We are just so excited to have the opportunity to bring breastfeeding to the conversation. Oftentimes there is a question when it comes to substance abuse and mental health and breastfeeding, and how does that kind of play into it? And is that even an option for me at this point? Is that an option that's on the table, or is that a choice that I don't get to make for myself? And so Zarina and I jumped at the opportunity when we were asked to speak. So just thank you again so much. Zarina and I have worked together at ADHS for a short period of time, but we worked together at a local agency before that. So we have been together for a while now. And we are both very passionate when it comes to breastfeeding, lactation, and mental health. And so we're just really happy to be here. So at WIC, that's, the heart of what we do. And I really think that one of the main pillars of WIC is breastfeeding. And oftentimes parents will come to WIC and they'll say, we want to breastfeed, or we think that we want to breastfeed. And what our job at WIC is to really have parents lead the dance, and we support them with what their goals are. And if their goals are to breastfeed for a day, if their goals are to have mixed feeding, or if their goals are to exclusively breastfeed, we just meet them where they're at. And so getting back to the summit, Seeing Me Differently, how mental health and substance use impacts maternal and infant mortality, I wanted to open it up to all of you with a myth or a fact. What do you think? Should parents not breastfeed their babies while taking methadone? And I want to give a huge shout out to Tara this morning with Hushabye Nursery. I just was so moved by that, and with that stigma that comes with the treatment of methadone. And so I guess I should open up my chat. I can't see. Okay, good. I'm seeing a lot of myths. Yes, exactly. So if I click this next little, and how cute are the breastfeeding emojis, right? I knew we just met it. We were on the map when we got that breastfeeding emoji. So let me see if I can click here. Yeah, so that is a myth. And so we are going to get into a resource that we utilize at the WIC program. And it is oh, I just lost my train of thought. It is a resource that we utilize, but at the end of the day, parents don't have to choose between their own mental health, their medication, and breastfeeding. Sometimes these can be compatible, and more often than not, breastfeeding and medication are compatible. And so with that, when we get down to methadone, which was one of the examples that we're using today. And we're going to also talk about postpartum depression and medications for that. We kind of all hail to Dr. Hale. It's just so funny. Hail and Hale. So Dr. Hale, he has this great resource. It's called Medication in Mother's Milk. And he comes out with a new resource about every 2 years or so. And so the 2023 resource was just released. So we had the 2021, now the 2023 just came out. So those will be hitting the WIC clinics very soon. And so when clients come to the WIC program, or if they call the breastfeeding hotline, or if they come to us and they say, you know, I'm on methadone, but I really want to breastfeed. You know, is this compatible? Is this something that I can do? Or I'm on Zoloft because I'm struggling. Or I was on Zoloft before I was off it during pregnancy, and now I want to merge back into that. Is that something that is compatible with breastfeeding? One of the things that we look at here with Dr. Hale's lactation risk category is this is the resource that we utilize. So he has a level 1 to level 5. And so one thing that I want to point out is that WIC staff don't recommend medications. We don't recommend drugs. We give evidence-based information to the family, and then the family can decide what works best for them. We explain to them how how the lactation risk categories are, how to understand them, and then we empower them to make that decision for them. We don't say, oh, you need to go back to your doctor, and if they said you can't take methadone while breastfeeding, they're wrong. It's not an argument that we get into. We just give them the information, that evidence-based information, and allow them to make that decision. Because sometimes parents will come in and say, you know, hey, you know, Amanda, I'm really upset. I just came back from my postpartum visit and I'm taking Zoloft, or I'm taking methadone, or whatever that medication is, and I have to stop breastfeeding because of that. And they're mourning the loss of that relationship. They're mourning the loss of that. And you know, we'll say, well, how do you feel about that? And we'll get into a conversation and we'll say, oh, well, we have this great resource. Is it okay with you if we look at that medication and see what this says? And they say yes or no, we go from there. Other times parents need to stop, or they want to stop. And so that's okay too. So we just see where they're at and we follow the lead. They set the tone and we follow them in that dance. So we have level 1 to level 5 here. So level 1 would be compatible. And what that means is that this drug has been taken by a very large number of breastfeeding moms, and that there are a lot of studies show that this is a compatible drug, that there's no reason to stop or to wean breastfeeding when it comes to that drug. Level 2 and level 3, they're both probably compatible. And so I put a little explanation here just so that way it can be a little bit more defined here for you. So with the level 2, there's limited studies, and with level 3, there's no control studies, but it's minimal untoward effects with the infant. And so with level 3 and under, level 1, 2, and 3, we would say yes, that is compatible with breastfeeding. Level 4 and level 5 could be potentially hazardous or hazardous. One thing to note is that we want to make sure that we're current with all of our resources with the new resources that are coming out with Dr. Hale. So, you know, I mentioned earlier that we had the 2021 and now we get the 2023, because drugs can change over time. So a drug might be a level 4 just because there aren't a lot of studies. We have to wait for moms to take that drug, to send in their milk to Dr. Hale so he can test it. And then it might be, oh, okay, we thought it was potentially hazardous just because we didn't have any studies before, and now we've been able to study it, and now we see that it's compatible or probably compatible. So making sure that we're utilizing that correct and up-to-date resource. So here you can see this new green cover is the new cover for the 2023. So moving forward, When it comes to postpartum depression and anxiety medications, this is something that we tend to see a lot, in that fourth trimester when moms are coming in, when families are coming in, they're sleep deprived. They're trying to figure out how to feed their newborn. They're trying to figure out how to get their newborn to sleep for longer. Whether it's that first baby or that second baby or that 10th baby, whatever it is, it's hard figuring out that new dynamic. And at the end of the day, we don't want parents to have to choose between their own health and the health of their infant. And so we came up with this little graph here, and you can see here that we have the brand name, so Lexapro, Zoloft, Cymbalta, Exafor, and Xanax, and then we have alternatives, and then down here we have how it's listed in Dr. Hale's medication and mother's milk book. And one thing that I do want to note is that all WIC staff, so from clerk up to WIC director and everyone in between are trained on how to utilize this resource in the WIC clinic, because it is everyone's job to protect breastfeeding and to promote breastfeeding and to meet these parents where they're at. So if they want to breastfeed for one day, if they want to breastfeed one time, or if they want to breastfeed until their kid is 5 years old, at some point they may need to take a medication, whether it be Zoloft, whether it be Tylenol or Claritin, whatever the case is. We have to merge back into life when we breastfeed, and so it's something that we take seriously, and we want to make sure that parents get that evidence-based education and evidence-based information when they're trying to make a plan for their family and medication when it comes to breastfeeding. Because at the end of the day, parents just want what's best for them and for their babies, right? All right, so setting the record straight. We know that for postpartum depression, most antidepressants are going to be okay for breastfeeding moms. There's no need to wean, there's no need to stop that unless, mom or baby decide that's the end of the journey. And we know that the risk of untreated postpartum depression is way greater than the risk of most medications that can be taken to alleviate that. And so one of my good friends said that she had a mom come in, and she said that you just never want a mom to have to choose between the health of her own mental health and the health of her baby. And so that just always kind of stays with me, and it just kind of hovers in there. And if you know a mom, or if you're a mom or a parent, a father, a partner who has struggled with this, it is something hard to kind of navigate, and to have to deal with that, and then to have to give up or lose that breastfeeding journey can just make it tenfold worse. So we're going to talk about WIC and IBCLC services. So of course, Zarina and I are both with the WIC program. When you are a participant on the WIC program, you also get IBCLC services. So that's International Board Certified Lactation Consultant Services. You can visit our website at azwic.gov.